Good afternoon, everybody. I hope you can all hear me, and welcome to this second day of our Tech Fest for Social Good, which is part of Digital Leaders Week 2021. I guess before I go into full introductions, if you could just confirm that you can hear me. If there's a few people that just say confirm that in the chat, that would be brilliant. Yes, so welcome to this session, hosted by Wales Cooperative Centre and sponsored by Digital Leaders, WCBA and Welsh Government. I'm Dewi Smith. I'm a programme manager on Digital Communities Wales, which is a Welsh Government funded programme run by the Wales Cooperative Centre. I'm going to be chairing this session this afternoon. And again, we're delighted to be hosting another week-long virtual festival to celebrate and showcase the benefits of digital technology for social good. This free festival brings together experts from across public, private, third and social business sectors to share experience and knowledge and inspire others to explore the potential of digital technology to improve people's lives and the communities they live in. So if you're a social enterprise, cooperative, charity, not-for-profit, public sector body or community group that wants to explore tech for good and all that entails, then you have come to the right place. Again, we invite you to take a look at all the events that we're running this week and to get involved and get inspired. Yeah, we're delighted you could join us this afternoon. This is the final event of our community-themed day, titled Helping People to Re-engage with Their Community Post-COVID. Yeah, it's a really good session, and I'll introduce the speakers shortly. Yeah, a bit strange, obviously, no housekeeping to do as such for this session. We're not going to run a virtual fire drill just for reasons of authenticity. And obviously, you can sort out your own refreshments, and hopefully you know where your own toilets are. However, if you do have any problems with the Remo platform, do let us know in the chat. My colleague Gemma Murphy will be able to assist you there. Hopefully it all goes smoothly and there are no issues. If there are any issues, like I said, just highlight it in the chat. There's a couple of things that you can do in terms of quick fixes. So you might want to refresh your browser and re-enter the room. The optimum browser for Remo is Chrome. If I could just draw your attention as well to the right-hand side of the screen, there's a chat function again. So, you know, you've got you can communicate with everybody else in the session there. You've got a list of participants as well. And we've also got a Q&A section there, which I will talk about a little bit more in a minute as well. Yes, in the top right of your screen, you've got the calendar icon there as well. So that provides a full running order for today's event. So without further ado, I will, before I do that, I need to mention live captioning as well. So my colleague Gemma as well will provide some information in the chat box around live captioning, which she has already done. So yeah, without further ado, I will invite all the speakers to the stage. So if you could all turn on your cameras. Brilliant. So as speakers today, and I'll let them give their own intro, but to start with, we've got Kimberly Littlemore, who's the founder and creative director of eHealth. Can I pass over to you now, Kimberly?
Yeah, hi there, everyone. I'm Kimberly from eHealth Digital Media, and I'm presenting today on behalf of an engagement initiative called Get There Together.
Thank you, Kimberly. And then on to Sioned Young, who works for Age Cymru Gwynedd y Môn.
Thank you. Yeah, here with Kimberly presenting about Get There Together.
And then following that, we'll move on to James Ingram from Sign Up, who's going to be talking about the Chai Community app.
Hi everybody. Yeah, I've got some slides today and happy to talk through them afterwards, after the event, if anyone wants to chat.
Thanks, James. Then we'll be moving on to Jenny. Jenny's been having a couple of issues with the camera, but I think we've overcome those now. Jenny works as a volunteer coordinator on Digital Communities Wales.
Hello everyone. Yes, if I disappear, that's why. It's not because I'm camera shy. Yes, so I'm volunteer coordinator for Digital Communities Wales, and I support organisations all across the country to develop and support digital volunteers.
And last but not least, we've got Emma Williams from Digital Communities Wales again. So Emma is a trainer on the Digital Communities Wales programme.
Hi, yeah, I'm Emma, and yeah, I train people from all over Wales about everything to do with digital and digital inclusion. I'm based in North Wales, but just like everything else, everything's gone digital, so I cover the whole of Wales now, and I'll be doing a short presentation on how you can implement social media into your community engagement as well. So, hi.
That's great, thank you. And yes, so there'll be an opportunity, there'll be a Q&A session after all the presentations. So if you do have any questions, please do make a note of them, and you can pop them in the Q&A bit after the presentations. I'll give a bit of an overview as to how you do that in case there are you have any questions about that. So I'm going to turn off my camera and microphone now and pass over to, I believe it's a video that's first, Kimberly and Shannon presenting now. Thanks.
Okay, so you're a short film that was made in support of the Get There Together library of films and presentations to support people in Wales to access activities in their community after COVID. So I'll hand over to Mike, who I believe is going to press the button and play.
Sorry, I'm just going to come in there. James, can you turn your camera and mic off? Because you stayed on the screen for that video. Thank you, James. I'll pass back to Kimberly for the presentation.
So thanks, Mike. If you could put up the first slide, that'd be brilliant. So as you could probably see, we were in South Wales when I made that film because it only rains in South Wales. I know it never rains in North Wales. And I made that film with my mum, Pauline Jenkins, who, like my dad and her husband, Clive here, are both living with dementia. And they've just spent a year indoors, confined away from their usual activities, like many people. And they're finding it hard to get back to some kind of normal, again, a really common experience. So the film you've just watched, the idea was that it could be useful for anyone in Wales living with dementia, thinking about getting out again. And it's a reminder, the idea of it was that it was a reminder that it's good to get out, even if it is just for 5 minutes. Because so many outings tend to be for medical appointments and things like that, and they shouldn't always be. Next slide, please. So the project that we're working on is called Get There Together. It's a national project run by Dr. Natalie Elliott to help people living with dementia, but also includes, of course, anyone else with challenges about re-entering the world post-pandemic. And the purpose is to help people get ready to access places and services safely. It has a collection of short videos and leaflets all about the practicalities of getting back out into the community, whether it's just for some fresh air or to go to specific places such as a GP surgery, the high street, or to the bank, for example. And the stated aims of Get There Together is to reduce anxiety, encourage inclusion, and reduce isolation. So I'm typical of one of the people that Dr. Elliott's brought together to create a national team of people interested in using digital media to communicate with people as we emerge from the pandemic and remind them of some of the changes that have taken place in the world outside the front door that involve masks, one-way systems, and hand sanitizer. I'm based in Swansea, and for my day job, I create films. Oh, there we are. Stay there, Mike. I create films for Pocket Medic to support people to live well with chronic conditions. And we've just made a first series about living well with dementia, which is why I've got involved, as it's a subject very close to my heart. If you could change the slide, please. I used to work for the BBC and look after Comic Relief. I did that for about 10 years. So using film to support people and share stories is right up my street. Next slide, please. So the national group includes people from across Wales, and we encourage and invite you to join us. So, for example, we have people from a wide range of organisations with connections to living with dementia, in housing, community groups, Alzheimer's Society, the ambulance service, police, shopping centres. So we're just wondering whether that might sound like anyone like you. We're always looking for people who are good at networking and finding ways of sharing the film content with those who'll find it valuable. So you'll be hearing shortly from Chai Community, and they're a really good example of people who might be able to help, or an app that might be able to help people to share these films with people who might find them helpful. So maybe you live with dementia and want to suggest a subject for a film, or give feedback on the films, or maybe could you make a film? There's roles for everyone. And in a minute, you'll meet Sioned, who'll show you the other kinds of presentations that have been made to help people adapt to the changes in our world as a result of COVID-19 safety measures. Next slide, please. And you'll see that the films have also been made in Welsh. Sean will tell you how to access the resources and how to share them with others. So my last slide, which is this one, has our contact details on them in case you'd like to follow up and ask any questions. And it also has quick links to the library in both English and Welsh. So without further ado, I will hand you over to Sioned.
Thank you. Hi, so I'm Sioned. I work for Age Cymru Gwynedd y Môn, and I joined the Get There Together project back in September 2020 and established the Anglesey subgroup. So the first step was to establish membership within the group, as is the case with all the subgroups across Wales. So subgroups generally consist of a balance of organisations and people that can support in having the videos made and also receiving feedback from individuals about what kind of videos they actually want to be seen. So as you can see from the slide here, this is an idea of the membership in Gwynedd and Anglesey, obviously because we share quite lots of services across Gwynedd and Anglesey. We work very closely together. Especially on Anglesey, we work very closely with Medre and Môn, so they are the voluntary council for the county, and with their local asset coordinators who have direct contact to individuals and businesses across the island, and were great right at the start of the project in reaching out to businesses and asking for their support in creating these videos. We also work closely with Alzheimer's Society, who have been great in collating feedback from people living with dementia and their carers about the type of videos they want and any sort of feedback. We also have representatives from all the subgroups attend fortnightly national meetings to share insights, learnings, challenges, and to pilot new ideas. It's been really great to have a chance to meet together And just to give you a scope of what we've been doing, in our last meeting, we were discussing potentials of filming a few 360 videos so people could have a full virtual reality experience of visiting somewhere. If I get the next slide, please. Yeah, thank you. Yeah, so videos from all regions are available to access on the Dewis Cymru website by searching Get There Together videos, or by following the short links at the bottom there. Yeah, so you can search, so Get There Together videos, and then you can select your region postcode. And as you can see here on this slide, this is what you'll see when you select the page. So what's really good is that all videos are embedded onto the site, so you don't have to be directed anywhere else. You can watch the video on the website itself. So this is a video from Cumbria Surgery, and it has over 250 views so far. Much of that can be accredited to the video also being featured on the surgery's website. So if somebody's interested, looking to or need to go to the doctors, and they can go to their website and watch the video. We also encourage businesses to share the videos on their social media, and people can also directly contact each subgroup to request paper copies, because we are aware not everybody can access the resources online. Yes, we can have the next slide, please. So this is just a general idea of how some of the videos look. So yeah, this is the one from the Cumbria Surgery. So when it comes to actually creating the videos, members from each subgroup reaches out to businesses and services to take part. So these can be business and services that we know lots of people use, or that we've received feedback that people would appreciate a video. And the way they can take part can be one of two ways. So a member of the subgroup can visit a venue and take photos. I know, especially in South Wales, something that's been really successful is lots of universities have been taking part, and their students have been volunteering their time or adding it as part of their work to go and take some pictures on behalf of the subgroups. Another way to contribute pictures, sorry, if we just go back the slide. Yeah, another way is, thank you, another way is that businesses are asked to take their own photos and send them to us. This is a really good way, obviously at the height of the pandemic, because all the organisations trying to keep as safe as possible and limit the amount of travel as possible. So businesses take their own photos. What we generally ask is that people take about 5 photos of main changes to the building since the pandemic. Videos are usually no longer than a minute, so not too much information. And I particularly like this video because the people at the surgery went all out in helping us. It's actually the doctors here role-playing the experience of a patient visiting, because we had a lot of feedback saying that the presence of people and how it actually looks is really good for the videos. We also stick with still images because it's easier to edit. I do know of an organisation that filmed a really high-tech video, not for our project, but for something else. Really high-tech video showing you the way around their venue, and unfortunately the week afterwards they introduced the law that you had to wear a mask. So with this, if there's any change in regulations, if they remove something or add something, it's simply a process of just changing around the picture instead of having to film a whole other video, and it makes it easier to pause and to take in information. We also, all the volunteers or the people part of this project receive training from Digital Communities Wales as well on how to create a video. So there's a free software to use on Apple and Android devices. So if we just head up to the next slide, please, thank you. So yeah, obviously, as a new project, I wanted to make sure that it's as effective as possible. Feedback is really important. So at Anglesey, we add a link to feedback questionnaire at the bottom of each of our video descriptions on YouTube. But there's also been quite a few feedback focus groups. So these are just few examples of the feedback that we received. And then this is often discussed in the national meetings as well. So make sure that we're sharing learning. So we've got new groups starting all the time as well. So in the past 6 weeks, we've had about, I think 3 or 4 new counties joined the project, and it's really good, obviously, if there's learnings and if there's feedback, that we don't reinvent the wheel in a way, that we share our experiences with the new members so they can make as effective and as useful videos as possible. But yeah, general feedback saying that the videos, the short format really works, that it's great to have a picture of the building outside to give context, and at the same time as well to give perspective, to not have pictures too zoomed in so people know the scale of something. But yeah, and yeah, we're always welcoming feedback as well. So because like these videos are open to obviously people living with dementia, with general anxiety, with autism, but also be for their carers or for other people who can recommend the video. So yeah, we're very much open to accepting feedback, and like Kimberly said, suggestions as well for any videos you'd like. So yeah, thank you very much for listening to us, and yeah, we'd be more than happy to answer any questions at the end. Thank you.
Wonderful. Thank you very much. Diolch yn fawr iawn to Kimberly and Sioned. That was a really interesting presentation there, and some incredible work that's gone on during the pandemic, and obviously to bring partnerships like that together across all parts of Wales in such a short period of time and create all the content that has been created. Very impressive. I'm going to pass on to James Ingram now, and he's going to tell us a little bit more about the Chai community app. So I'm going to turn my camera off now. James, if you want to turn your camera on and share your screen.
James, if you can turn your camera on to join us on the stage. Okay, if
we'll give it a few more seconds, and we'll see.
If James isn't with us, we'll go on to if we go on to Jenny.
Yeah.
We'll come back to James then. Cheers, Zoe.
Jenny, if you want to turn your camera on, and we'll see whether that's working. Yeah, working. Okay, I'll pass over to you now, Jenny, and we'll
Thank you. Hello, everyone. Hi. I'm just going to screen. I hope you can see that. So yeah, I mean, just really interesting to be here, and really interesting as well to find out a bit more about the Get There Together project. It's really, really interesting, and I think, I mean, one of the kind of themes that I wanted to talk about really was about how we can kind of move forward after the pandemic, and the sorts of things that people are doing across Wales that are really interesting. I think it's really amazing to see how technology, obviously we're all about technology and Digital Communities Wales, and it's really interesting to see how people are using technology to support people in their communities, and how they're using technology to help people to re-engage with their communities. And that's obviously what this is all about. And I think at the beginning of the pandemic, obviously there was this huge shift for everyone. Even if you were quite sort of digitally competent and digitally skilled, we all suddenly had to move online, and there was a big culture shift for everyone. And I think one of the issues that we've got is perhaps some people in our communities were left behind by that, and didn't have the skills or the confidence, or maybe the access to use technology in the way that we were all able to. And it's a particular issue perhaps for people who were shielding, and who just had to disengage completely. And speaking to people across Wales, I think sometimes people felt that almost overnight everything that they relied on was gone. Their community links, their church, their kind of connection with other people, their family, even just being able to get food and medication was kind of gone overnight. And without the skills, the digital skills to join Zoom calls, or to join all the things that were going online, people were feeling really, really isolated. And I think it's really interesting to see these ways that we're using technology to reach across that divide, to kind of reach out to people in communities. My role is to support organisations across Wales to develop digital volunteers and develop digital volunteering projects. So, I mean, it's not always kind of formal volunteering. It's not always the kind of that sense of volunteering you think of seeing a role on an advert and then applying and doing DBS checks and all that. It's much more sort of a loose idea of volunteering than that. So working with people in supporting mutual aid groups, the kind of groups that sprang up all over Wales to kind of deal with that initial need that the pandemic created of these people that were suddenly isolated from everything that they knew, and also sort of supporting organisations to develop the digital skills in their staff. So creating digital champions, for example, who can work in an organisation to help their colleagues to develop digital skills. And I think one of the things that I think is quite a thread through this particular session is that it isn't about the technology so much as it's about the people, and it's about the meaningful connections that technology can make between people. And I think the Get There Together program is a kind of a really brilliant example of that. It's not about forcing someone to learn how to do email or forcing someone to learn how to use Zoom. It's about finding out what people need and then using technology to meet that need. And it's about collaborating, and it's about co-producing things, getting together and as a community and finding out what people need. And sometimes technology can be a way to facilitate that in a really positive way. And I think going forward from the pandemic, I think at the beginning I'd speak to a lot of organisations and I think they felt, well, this is just temporary, we're all going to move past this, we're going to go back to normal. And now I think the sense is amongst organisations across Wales that isn't the case, and that actually things are going to be different, and there's going to be maybe like a blended approach to how they deal with things in the future. And it's really interesting and how we kind of tackle that. So, I mean, there's some interesting links. I mean, this will be distributed afterwards if you're interested. There's some good resources on here, I think, if you're interested in volunteering and digital volunteering in particular. But there's some really interesting research that's been published recently by the Wales Centre for Public Policy about, it's a really catchy title, The Role of Communities and the Use of Technology in Mitigating Loneliness During the Coronavirus Pandemic. Very catchy, but the actual research itself is really interesting, and it's about how we go forward with these digital spaces, with these online spaces that we've created, and that how it's really, really important for us to collaborate together, and that organisations from all different sectors, from the third sector, but also statutory and private sector, that we all try and collaborate really to co-produce meaningful technology and meaningful digital spaces, because there's no point in creating spaces that are not accessible to the people, or they're not going to be functional for the people that actually need the services. And I think, I mean, it might be useful if I talk a little bit about as well some of the work that we've been doing with various organisations across Wales that we're really proud of. We've been working particularly with some CVCs across Wales, in particular Swansea Council for Voluntary Service and Powys Association of Voluntary Organisations. Both we've worked with to develop what we would call a digital companion scheme, which is more like a digital befriending. And I think this is really, really useful in terms of reaching out to the people that are most digitally excluded, the ones that are really going to struggle to kind of to join even the kind of most basic of digital space, and just supporting them to develop and train and support digital befrienders, basically. And it's more about, again, it's not about the technology, it's about the connections between people, and it's about making those connections meaningful. So we focus more on, don't try and teach people stuff that you think is important. It's about learning about somebody, what's meaningful to you, where did you go, what did you like to do, what kind of what makes you feel passionate, and then finding ways to engage them digitally with that. So if it's, I really miss my grandchildren, it's right, well, let's work on getting you into a Zoom call, and that can be our focus, because the end result is meaningful, but you kind of learn digital stuff along the way. We've been doing some work with Sporting Memories. There's an amazing charity that supports people who are isolated and living with dementia. And that, again, it's about using, the online clubs are about using technology, but to link people together who've got a passion for sport and want to talk about sport and remember sporting events. And we've also been doing some work with AbilityNet, which is a UK-wide organisation with a focus on digital accessibility, so supporting people with any kind of disability to get online. So again, reducing and removing those barriers to engaging. And I think those sorts of projects are really important in breaking down barriers to us kind of bringing people back together and bringing people back into to community spaces, but also online spaces. And there's some really positive things that have come out of the pandemic in terms of leveling the playing field, I suppose, for people joining online spaces when perhaps they would struggled with accessibility, like physical accessibility into those spaces, and maybe feeling, as the Get There Together project spoke about, the kind of feeling anxious about going to a club, a physical club, and not feeling comfortable walking through the door, but maybe being able to join an online club first to get a sense of what it's like, and then eventually moving to a kind of face-to-face engagement. And those things are really positive and really good. So we want to kind of keep those things, and then maybe have this kind of blended future approach. So I suppose what I really want to get across is that, I mean, this kind of discussion is brilliant, this kind of collaboration and talking about how we can listen to each other and learn from each other, and how we can kind of get into this new future together, and make things better for everyone. So obviously, if you're an organisation that would like to learn more about supporting and developing digital volunteers, please get in touch. We'd love to hear from you. Thanks very much.
Brilliant. Thank you very much, Jenny. Kind of a whistle-stop tour of some of the work that's been ongoing throughout the pandemic. Just to pick up on that a little bit, and to tie in with some of the work that Sinead had been doing on Anglesey as well. Jenny mentioned kind of digital companions and digital volunteers that have been trained there. I think we've trained massive numbers of digital companions right across Wales, and it's been really heartening to see the way there has been that co-production and that kind of co-development of projects, and kind of tying various strands together. So really interesting presentation there from Jenny. Just to touch on the point that Mike has made in the comments there, if you do have questions as we go along, if you could pop them in the Q&A section, it'd be great to have a few questions there before moving into the Q&A bit. It would mean I don't have to think of questions prior to that, but yeah, if you do have any questions, I think there's probably lots of things, additional bits and pieces you'd like to know, so please do ask in preparation for the panel session. Pass over to James Ingram now from Sign Up, and he's going to be talking about the Chai community app. So James, just to pass over to you, and just
means it's working.
Share your screen. We're working now. Brilliant.
That's good news.
I'll leave you to it.
A few technical problems there. One of them involved pulling the power cable out of my laptop. Didn't help. Showing fine. So I'm going to talk to you. I'm going to go through just a few of these slides. There's quite a few of them, and yeah, I'll certainly be sharing them with anybody who wants them after the event. I think they'll probably all be shared. This is an app that has stemmed from. Oh, maybe I'm not going to be able to show you the slides. Okay. Yeah. It stemmed from initial work with a health board looking at acute care. We worked with actually 2 health boards on acute care in hospital apps. And when the pandemic kicked off at the beginning of last year, we looked at what we were doing in hospitals, and we thought, actually, there's no reason why the level of computing and collaboration we were looking at with nurses and doctors and patients in hospital shouldn't be applied to people who are clearly going to be struggling in the community. So we looked at developing the app and switching out nurses for volunteers, friends and family, and put all the other tools in there, all the other collaborative tools, and you know, alarms and notices and messaging, and simply changed the acute care plans for chronic care plans and other elements of concern for people in this community. The thing that struck us most was that vulnerable people really don't ask for help. And this was really shown out by an outpouring of volunteers in the NHS who were looking to support people in the community, but very quickly it was evident that there was more volunteers than there was tasks to do. And that's because the organisers of the volunteers weren't able to ascertain who had the problems in the community. So we felt there was a need to enhance the sort of informal support that is available, and that's what this app is all about. And we're targeting, you know, isolated people, clearly the digitally excluded. We've been hearing about that today, and health inequalities. So the key thing here that we discovered was that, you know, the benefits of integrated care are really well understood. You all know about this. The thing that we felt was missing was this more formal connection of voluntary services, friends and family. A bit like Jenny was saying earlier, it's important for the third section, statutory services, to work together. This is what we're really trying to do. So you'll hear in a few minutes how the information can be shared between these organisations. So it's really about discovering unmet needs, monitoring a person's essentials, helping with basics, could be shopping, pet care, understanding their vulnerabilities, keeping a watchful eye. These are all the things that nurses would do in a hospital. It's slightly different, of course, but the same principles. Understanding the impact of isolation, which is key, but also looking at chronic conditions. What we're trying to do, we recognize that a lot of volunteers are meeting people all the time, but they just didn't have a framework to work around to actually ascertain how somebody really is. So we have a contact log that individuals can fill in each time they meet somebody, just to try and establish what their problems might be. It doesn't need any training to do this. It's relatively straightforward. We also have daily assistance and health diaries. I'll talk a bit about those in a moment. So whether it's helping someone with shopping and just putting in a shopping list, or trying to ascertain if they've got anything about their speech or looks or their mannerisms that could be a concern, these are the sort of things you can pick up, and you can identify what the level of concern might be, flag it, and it helps other people in the community who are working with you, looking after this person, understand there's a potential concern here. For some reason this isn't showing quite as it should, but the point of showing this was actually to talk about Kimberly's Pocket Medic films that we integrate into our app, and that's the point of today's presentation, is to explain that the videos you were hearing about from Kimberly and Shoned, the aim of our app is to try, there we go, it's caught up. The aim is to present those videos in context when someone is helping somebody. This is a video about COPD that Kimberly's team has done. It's a great video. It has a doctor talking about the subject and a patient or a sufferer of COPD explaining the exercises they can do. It's very easy to embed videos in here, and the videos can be based around someone's postcode and their conditions. So depending on who they are and where they are, or what symptoms they may have, it'll show the right video at the right time to the person who's supporting them. You can organize teams within the app, which is quite important. So it could be based on where you live, it could be based on a particular function, whether it's telephone support or driver support, befriending, as we heard about, or if it's a specific condition like diabetes or dementia, things like that. So I think this is something we're doing with actually, it's about long COVID, and the technology we developed with them is really opening up the sharing of information between community groups, families and friends, with doctors, secondary care, friends and family, whoever the individual trusts. Actually, they can share the data just by simply organizing a few words, and they can tell them on the phone, so they don't need to understand how the technology works. It's a very simple way of giving somebody who you trust access to the record. And if it's a volunteer group, then the volunteer group can set that up on behalf of the individual, and the individual can phone the GP and say, could you please look at my records? I'm just not feeling well, and this is what my community group thinks about the situation. So it's about sharing symptoms, sharing conditions with the right people to get the right help. My computer is just not playing. I have to want to accept that I don't want it today. I've frozen up there. I don't know if you can still hear me.
Yeah, we can still hear you, Joseph.
I think I may have probably gone on time anyway, but I'm definitely having computer problems by the looks of it.
Brilliant. Now we can hear and see you fine, James. But thank you.
I pretty much got through my slides actually, so there's more slides there for people who can have them after the event. That's fine by me.
Yeah, if there's anything, is there anything else you wanted to cover, James, without the slides?
I think the key thing I wanted to talk about actually was that we use the app to connect hospitals, social services, and voluntary services and friends and family. And that's the big difference, I think, that we're actually recognizing the real value of volunteers. And they've not got a side bit part to play here, they've got a really crucial part to play. The NHS is under massive pressure at the moment. And we're hearing a lot at the moment that if you don't have a loud voice, you don't get heard in the NHS. What we're trying to do is enable volunteers to give vulnerable people a louder voice and to share their records with the right people and shout so they get looked after. And of course, helping into the community with very useful films like Kimberly and Shine have been talking about with their fantastic program, which is it's a great project, that project. So that's what we're trying to enable.
Brilliant, thank you, James. Yeah, I think we saw, obviously during the pandemic, that surge in volunteering and people willing to and wanting to volunteer and help their communities. So, yeah, you know, they're obviously crucial to this. And again, I think everything that we've been talking about, everything you mentioned in terms of what the app is trying to do, ties in with the programme for government that was launched by Welsh Government, was it today, as well, just in terms of kind of integrating all those various elements and how critical that is. And yeah, really interesting, and definitely something I want to follow up with you afterwards as well, James, if we can have a conversation about that. So yeah, we're going to move on to our final speaker now. So we've got Emma Williams from the Digital Communities Wales programme. So I'm going to pass over to Emma, and I am going to turn off my...
Hi everyone, I'm just going to share my screen before I get going. Here we go, share. Hi again everyone, so I'm Emma. I am a digital trainer for Digital Communities Wales. For the next 5 minutes or so, I'm just going to give you a snippet of how digital and social media can play a part in engaging with your community post-COVID, and how anyone can encourage people to take part in social activities through digital as well. So, social media is no longer just a tool for people to share photos of their lunch with friends, although some people still do. It's also now a platform where you can really easily engage with individuals and organisations and find others with similar interests and beliefs. Especially when it comes to engaging with the community, you're able to reach a lot more people than, say, a simple advert in the local paper. So a recent study, actually a few recent studies have shown that a lot more people are agree that their social media consumption has increased during the pandemic. I think the last study I saw was 72% of people agree that their social media consumption has increased. So it actually makes social media a real big hotspot for engagement in the world post-pandemic as well. Obviously, there's tons of social media platforms out there, but just for this short presentation, I'll focus on two of the giants of the community engagement sort of world, which are Twitter and Facebook. So I wanted to start off with Twitter just because it's a very popular and professional platform to engage with others. It's a way for you to quickly and easily send out short messages to the world, as well as liking, commenting, and sharing content as well. Because of this, it's really great for businesses, organisations, cooperatives, charities, and especially news broadcasts as well. And really, really great for networking and engagement. Twitter has arguably broken down that barrier between organisations and the public, and has made engagement between the two a lot more mainstream and like streamlined. So like, for example, members of the public can now tweet organisations for help and support rather than having to call or email, making it a lot more accessible to receive support sort of going forward as well. And one of my favourite features on Twitter for engagement is the polling feature. This is a way for you to ask your community questions in a quick and easy way. I personally use this a lot as a trainer, because I can ask my followers any questions regarding training, like what kind of training do my followers want, when do they want it, that kind of thing. So it can be used in a really positive way to engage with your community in a really easy way, really accessible way, and ask for opinions as well, which I think is really important. And the next platform is, of course, Facebook. And more specifically, I'll be discussing two features on Facebook, which is Facebook pages and Facebook groups, because these will allow you to engage with the community or with your community in very different ways. So Facebook pages act like a landing page for the public to see your organisation or your charity or business. And what I mean by that is that they are designed to be the first place you land on, essentially, when you first come across an organisation. And like these days, some organisations actually prefer a Facebook page over a website just because it's a lot more engaging, it's a lot easier to get information out to the public that way. And it's a great way for you to have all your information in one place, easy for your community to find and contact you. And you can promote like new post-pandemic events as well, and share support information all in one place for people to see. And all people need to do is just like your page in order for them to keep up to date with any information or events you post on your page, basically. However, another brilliant tool that is available through Facebook is Facebook groups. And just as the name suggests, groups is a way for you to bring a group of like-minded people together in one place to share ideas and information. So Facebook groups have actually been a really popular source of like community building over the pandemic, just because of the sense of community it actually brings completely virtually. And the light from that will definitely still be burning for post-pandemic, I think. So just some popular ones that I've known of, like popular Facebook groups that I've known of that have blossomed over the pandemic. There've been groups for cooking, like cooking groups where people share recipes and they share pictures of their finished dishes. Reading clubs. There's tons of reading clubs for people who want to discuss books, reviews, recommendations, that kind of thing. And of course, groups has been a haven for just communities dotted all around the world, basically, who have not been able to meet face-to-face over the past year, but have still been able to communicate in a safe space where they can be open and they can be honest. And speaking of that, these groups can be open to anyone. or they can be closed to only members you invite. You can even go as far as put a password on there, so only the people that you trust can go on the group. It completely depends on what kind of community you're hoping to support and engage with, basically. And there are some brilliant engagement tools on there. Just like Twitter, there's polls, there's surveys, and what is really great and what would be great going forward as well is that you can create events on groups that only members of that group are able to see and join, which, like I said, can be a really great way to utilize this platform for when we can finally have face-to-face events once again post-pandemic in a way that isn't too much of a jump, because everyone will have been used to being a part of that group before we go to face-to-face events again. So yeah, that was a really quick summary of our our hour-long social media and community engagement session. I hope it's given you just a flavour of how you can still use digital to still engage with your community post-pandemic. Like others have mentioned, since the pandemic, digital has very much shifted. So it's shifted from being what I thought was like a luxury to now being a necessity, and it is a necessity for like so many people now, and we can use that to our advantage to engage with more people in the future. Thank you for listening.
Brilliant. Diolch yn fawr, Emma. Thank you, Emma. Yeah, bit of a plug as well for Digital Communities Wales training now as well. I think over the course of the pandemic, we've developed a range of training, and yeah, please check out our web pages with details of the webinars that we're running, but also be aware that we can create bespoke content for organizations as well. So if you do have any queries or interest in that, do get in touch with us. Okay, I'm going to invite all the speakers to turn on their cameras now as well, and we're going to have a Q&A session. If you'd like to ask a question, as I mentioned earlier, please just click on the Q&A button. It's in the top right there, and there is one there. I do have a couple of questions, but it's always heartening when there are questions there already. More than welcome to ask your questions in Welsh or English, and again, I can translate those if anybody wants to ask a question in Welsh. If you could just, well, your name should come up anyway, but if you just, so that we have an idea of where you're from, yeah. And we'll go with the first question. So, well, we've dealt with the first question. Mike dealt with that already. So, the first question: what is your opinion, Emma, on paid boosting for small non-profits? Is it worth it? What about shadow banning groups' pages?
So, as for paid boosting, so Facebook is like leaders in advertising. I mean, we all know what Facebook's like. It's not always been the best news when it comes to Facebook and advertising, but they really are working on like their advertising model, and it does work quite well from my knowledge. It depends on what you need out of it, really. If you want more reach, you can really target the right people through advertising, through paid advertising. However, I would have to say it's not compulsory at all. I mean, you can reach people in a variety of different ways. I have to admit, my favorite feature of Facebook, and it's probably like the one reason I go onto Facebook these days, is groups that I was talking about. And it like advertising doesn't mean anything to groups because it's a completely different sort of feature. But with pages, if you do want more like more people to engage with, it is an option. My suggestion is, if you want to try it out, is just to try it out like for a while, see if you do get more engagement, and that's the best way for you to see if it works best for your nonprofit. As for shadow banning, it's something I've not really delved into much. I've heard a lot about it. it is there to stop spammers mainly from being able to spam groups and pages and such. So it's well, hopefully it's not something that should affect too many people, but I know that some, like Facebook, do sort of shadow ban the wrong people sometimes. But yeah, it's not something I've delved into too much, so I can't give too much information there on shadow banning. But yeah, it is there for spammers rather than everyday users and everyday sort of non-profits and stuff. So hopefully it isn't too much of a risk for you. Hope that answers your question.
Thanks, Emma. That's great. A question for Sinead and Kimberly. How do you ensure everyone's voice is heard or no one is left behind?
I guess we do things like this and ask anyone and everyone to join in with us. So Natalie Elliott has sort of put it out there to try and get as many people from across Wales to be involved, and then we will reach out to anyone else to ask those to join in. So of course we can't get everybody, but the ethos, I think it's fair to say, of what's being done is to be as inclusive as possible. If you've got any ideas, please just let us know if you think anybody hasn't been included.
And I guess just a bit of a follow-up on that, I had a couple of questions. So I know you mentioned all the different parts of Wales and the different partnerships that are happening there. I was just wondering, is there reasonably good coverage from all across Wales, or you know, I know I'm kind of quite familiar with what's happening in North Wales, but not so much about the rest of the country.
Sean would pick up from this, but just to say, it's not wide. I don't think they've got coverage across the nation, but there's a request for it. So Natalie's always sort of reviewing that. I think it's fair to say. I think Sinead's done the best. North Wales has by far outshone every other part of Wales and everything they've done. What do you think, Sinead?
I don't know. I think we've been very lucky in North Wales. Like I mentioned in the presentation, I think we had a really good connection right at the start with local asset coordinators who directly reached out to businesses. And I think we found, because I think it was one of them that suggested the idea of asking the businesses to contribute photos, so that really worked. And also a method that we found to really work really well is to make it sound as little work as possible, and people will be happy to help, because it's just sending a few photos, we make the videos. But yeah, in terms of reach, I know there's I know groups are in different stages as well. So I know myself in Anglesey, Mirren and Gwynedd, we've been part of the project since about September, but I know more in North East Wales, and they're just starting up now. So, but I think, yeah, they will be going over as many hurdles, I guess, because we've gone through that development process. So, yeah, I think there are a few areas that are not covered yet, but I think Natalie's the one with that information. But no, it's growing, fair play.
And I just had one more question around that as well, and I kind of it's a bit of a leading question because there clearly are, but I was just wondering, kind of beyond COVID, this seems like a really good approach. You know, we talked about you know, people who might be anxious about certain situations, and this works really well to support that. I was just wondering whether you'd kind of thought of applications for the program outside of COVID, kind of more generally, because it seems like it would have applications in other areas as well.
Well, I think there was the one that there's these, as Sean had mentioned, that there are these there was funding for 360 films. And so we were looking at that for, you know, we're seeing what it's like to have a scan for dementia. But we're also doing, I mean, there's so many of us working kind of in tandem. We're doing some work with people with living with learning disabilities, you know, what it's like to go into a hospital. So I think the idea of hand-holding, or not hand-holding, but you know what I mean, sharing experiences through film is quite common. But the key to it all is we can make all these lovely films, but there's no point if they're sitting there and nobody sees them, which is why we're so keen to work with you and James through Chai Community, for example, you know, to try and make sure that they get to people to be used and that they're easily accessible.
Brilliant. Thank you, Kimberly. We'll go to Jenny for a second. There's a question popped up there for you, Jenny. What are the qualities you're looking for in a digital volunteer / companion?
Yes, very interesting one. I get asked this a lot, actually. And I mean, our our sort of ethos is really, if you're looking for people to help other people get online, that you don't stress the IT skills too much. Because I think, well, I mean, I've shown today I'm quite good with technology, but my camera not working completely threw me. And I work with loads of people that are real like tech geniuses, but they're not experts at everything. You know, none of us are experts at everything. And I think sometimes people see themselves as, oh, no, I can't, I'm not very good at that. I couldn't possibly teach somebody that. But really, all you need is like a basic understanding and a willingness to learn, and not to be, if something goes wrong, not to be fazed by it. I think that's like almost the key thing. And then you just need other skills like wanting to help someone and the willingness to listen and, you know, patience and a sense of humor and like all the other stuff that you'd need as a good volunteer. So those are the really key skills. Not stressing the kind of IT brilliance is like key to, I think, finding really good digital volunteers.
And pass over to James. I saw a hand up.
Yeah, if I can just add to that, one of the I don't know, can you hear me all right? One of the community groups we were working with when we were developing our app on Anglesey, actually, fantastic bunch, and the average age, I think, of the key people who are learning to use the app as volunteers was probably over 80. And we had an absolute scream. And as long as you approach it in the right way and say, it doesn't matter if you lose your password or you forget this or whatever, and ideally do it in a fun way, get a video conference going, get them all doing things together. It can be really good fun. They learn a lot, and it's ultimately not that difficult. You just need a support group around you.
Brilliant, thank you, James. Yeah, just to whilst we're on the volunteers, so I think Shoned has answered that question. She's already shared some examples of the videos in the chat, I believe. So very, very efficient there. So question from Lisa Roberts: how much did digital volunteer to give per week?
I think it's really difficult to say. It depends on the kind of volunteering they're doing. I mean, digital befriending, you know, that kind of one-to-one, gentle stuff, I would say, I mean, it's really not much. I mean, maybe half an hour a week is going to be absolute tops, because you don't want to overwhelm people. And sometimes doing a lot at once, particularly with people with really low digital skills, is going to be overwhelming and too much for them. I mean, it depends. If it's more of a champion role and somebody in an organisation, they might have to spend maybe an hour a week talking to groups of people and sharing examples and answering queries and that sort of thing. But it really does depend on the role, I think. But not too much is definitely the rule of thumb, I would say.
Yeah, I think as Jenny's emphasised there, in terms of the different kind of digital volunteering strands that we offer, we've tried to offer that range. So you've got the digital companions who are at that kind of very informal level, and I think that's, you know, that's a really effective way of doing it, where it's a friend, family member, colleague, neighbor who's passing on those skills. But yeah, digital champions, slightly higher level, but yeah, there's no kind of hard and fast rules there, are there? Really. I just had one question for James, just around the app and the rollout across different health boards. Just wondering which health boards have kind of adopted the app. I know you're working across quite a large geographical area at the moment. It'd be good to yeah, just hear about that.
So with the health boards, we are working specifically with long COVID, and we've just literally finished developing that with Hola, so we're working with them. The community app is not for health boards, it's for community groups. And the link with the health boards is simply to provide them with access to the data if it's needed. So we don't need to deal with a health board. The community group doesn't need to deal with the health board. They can just do it if they want to. So that's the connection there. So we're hoping that in time, we won't just be looking at long COVID and not just with Hola, but we'll look to all the other different conditions that people suffer from in the community, particularly things like malnutrition and loneliness, which cause lots of problems themselves, and be able to provide the statistics to the health boards so that they can know what's happening in their community and plan the services accordingly. We developed that because of long COVID, but it applies to everything. The other thing where the health boards do get involved is that they can provide signposts to people in the app. So based on someone's conditions that have been reported, perhaps by their volunteer, messages will come up from the health board, giving them advice to social prescribing, or to other information, or to links to videos to provide them with specific help, and actually provides the GP with help as well. But that's another point. So that's where the health boards come in.
Brilliant. That's great. Thank you, James. A final opportunity for people to post any questions that they might have. We'll have an opportunity. Mike will send us all back to the various tables that are out there. So there's an opportunity for some networking. But if there are no further questions now, we'll bring this part to an end. The room's going to be open until 4 o'clock. So if you do have any, if you want to speak to any of us individually, then have a squiz around the various tables that are there. Yeah, please find a link to the full program in the chat box now as well. I hadn't actually checked the chat box when I read that out, but I'm assuming that'll be there shortly. Yeah, I hope you've had a good session. I found it really informative, and yeah, really heartening some of the amazing work that's gone on over the course of the pandemic. I think everybody, as Kimberly said, we're trying to spread the message far and wide, and the only way these things can succeed is by working together and kind of all pulling in the same direction. So please follow up after the session. You've got everyone's email addresses. So on that note, I'll say thank you very much, everybody.
Hi, Derry. I was just going to come in actually before you went, but people were interested to see one of the self-help videos that Sinead has been doing. So I don't know if I can just play that off. I'll play it, and then we can just exit after the video's been played. But I think it's just give a nice snapshot of the work that's been done there. So I'll play the video for people to see, and then we'll go back to the main floor then.
Perfect. Thanks, Mike.
It's only a minute long. There we go. It should be coming on screen soon. 1 sec. Needs to be one of those days where tech seems to be going. Here we go.